Joining me now is Dr. Stephanie Jackson, the Chief Clinical Value Officer at HonorHealth. And first and foremost, Dr. Jackson, thank you for your time right now. But to you and your colleagues, thank you for everything you're doing for the community right now. We truly appreciate it.
Thank you for having me. It's an honor to be here.
Well, I know a lot has changed over the past few months. So what should people expect when they come to HonorHealth now for care?
We have been always concerned, even before COVID, about patient safety. We were really fortunate in that we were already working on infection control as part of a national campaign for patient safety before the COVID crisis hit. So we were already prepared with a fleet of UV germ zapping robots in an attempt to try and keep viruses, bacteria, all sorts of things at a minimum. And then also we got disinfecting pods. And these pods use the robots so that we can wheel things in like IV poles or wheelchairs into that disinfection station and just make sure that everything's wiped clean. And so we were able to use that during this crisis to make sure that we were, had that extra measure of safety above and beyond what was required. And we've put in fever scanners at our employee entrances to make sure that none of our employees are coming to work sick. We have deployed a rapid testing strategy. We're one of the only places in the Valley that you can get your test results within 2 hours of arriving at the hospital. And that's allowed us to separate the COVID patients from the non-COVID patients, which is really important so that there's no chance at all of them spreading COVID to a non-COVID patient.
You guys are doing all the right things to make people feel safe, but we are hearing recent reports that health systems across the U.S. are not seeing the patients that might need care. What is your advice or what are your thoughts to people who need to get care now?
You shouldn't let your fear of COVID keep you from coming to the hospital. If you have a heart attack or a stroke, you need to come in. There's all those things that, we learned over the years to call 911 for. You should still do that. You should still come into the hospital. The other thing I'm starting to worry about is some of the screening tests like colonoscopies and mammograms. Those are still important. And then vaccination rates. If your kids are due for vaccines, you should still get them in to get those vaccines.
So along those lines, now that restrictions are starting to be lifted, what can people do to protect themselves still?
I think, you still really need to use a lot of common sense. The governors, laid out some guidelines for us, but then let common sense prevail. And, the studies show that people that wash their hands 10 times a day are less likely to get this than people who wash their hands 5 times a day. So don't forget that part. We get so much emphasis on the masking, but the hand washing is really important too.
Thank you so much, Dr. Jackson, for your time. And once again, to you and your colleagues for all that you are doing. Stay safe. And if you would like more information on HonorHealth, please head to their website.